Welcome to the Western North Carolina School of Massage. My name is John, and today we're going to learn neuromuscular therapy to the brachioradialis. Brachioradialis muscle is located on the forearm, and we're going to begin with a myofascial stretch over the muscle. It crosses the elbow, so we want to make sure our stretch is affecting all the way across the elbow. We're doing myofascial release with tension held for approximately 1 minute. This allows the collagen fibers to respond to our touch. Collagen is primarily a protein molecule, and its properties are affected by heat and mechanical force. That effect is known as thixotropy. Once we've held the stretch for approximately a minute, and I'll move on just for demonstration purposes, then we're going to do some myofascial rolling over the muscle. The lower or the distal half is primarily a tendon, so you want to focus most of your efforts in this region. The nickname for the muscle is painful weak grip. That's one of the main symptoms a client will complain of, is that their grip is weak. They might not be able to hold their coffee in the morning. They'll drop mugs or drinks, and it hurts, typically at the proximal aspect near the lateral epicondyle. Matter of fact, one of the symptoms that a client will also complain of is tennis elbow or lateral epicondylitis from trigger points in this muscle. We're going to begin treating this muscle after myofascial release. We're not going to apply lubricant, we're going to apply a pincer compression to the muscle. If you're not sure where it is, you can ask your partner to flex their arm, and there it pops up right off the humeral ulnar joint. Thank you. And then we're going to come in and compress, pincer compress the muscle, and help alleviate tennis elbow-like symptoms. We can hold this for 10 to 12 seconds, or better yet, we can communicate with our partner and let them tell us when it feels better. Will you do that? This muscle attaches at the lateral supracondylar ridge of the humerus. It feels better, which is right here, and then crosses the elbow and attaches to the siloid process of the radius. It is one of the few forearm muscles that does not cross the wrist, thereby only affecting the elbow in flexion. The essential pain pattern not only is at the lateral epicondyle of the humerus, but it also refers down to the base of the dorsum of the thumb, between the thumb and first finger. So right in here is the pain referral pattern, right at the base of the thumb, as well as the lateral epicondyle. People can overload this muscle from gripping large diameter objects, gripping and twisting, such as opening up a pickle jar over and over, digging with a trowel in the garden, using a screwdriver. Okay, and maybe one more position. You can pincer compress it. In this case, not so much. Once we've done pincer compression to the muscle belly in the proximal half, I'm just going to come through here and deep stripping effleurage to the muscle. This is one of 7 muscles that are typically involved in lateral epicondylitis. The first one, going in order of importance, is supinator, then the brachioradialis, the extensor carpi radialis longus, the extensor digitorum, the triceps brachii, the anconeus, the biceps, and the brachialis. These are all muscles commonly involved in tennis elbow in order of importance. After you've done deep stripping effleurage to the brachioradialis, you can go back and see if there's any areas of tension to do trigger point pressure release with. If not, then we're going to finish with compression and friction to the lateral supracondylar ridge to help stimulate a Golgi tendon organism response, which inhibits muscle contraction. And then down here along the tendon at the styloid process, compress and friction away from the attachment site toward the muscle belly to stimulate Golgi tendon organ inhibitory response to the muscle fibers. And that's a basic overview of how to treat one of the muscles involved in a painful weak grip and tennis elbow.